Good afternoon, all. Okay, today we all are have gathered here for a webinar on the topic Standard Treatment Protocols on Siddha System of Medicine for Common Ailments. And today we have our eminent faculty, Dr.T. Thirunarayanan. And before starting the session, we'll just go for a 1 minute silent prayer. Okay. About our faculty, you may be knowing him very well because he has already taken so much of classes to us. Because I do remember, because after completing our BSMS in 2009, I think 2009 2010, we have started our session, means CME sessions at Trivandrum. And he was the one who supported us very well during that time for hosting such CMAs and for conducting classes. Of course, all such things, Dr. Thirunarayanan sir was there. And so I can't forget him at any pace of my life, because he was there for supporting in a very good manner. And Dr. T. Thirunarayanan, an alumni of Government Siddha Medical College, has 34 years of experience in different spheres of Indian system of medicine, including teaching. Sorry. Including teaching, training, clinical and industrial research. So, and he has a membership in member AUSDTAB, Government of India, member Standing Finance Committee, General Body, National Institute of Siddha, member EMR Project Appraisal Committee, Ministry of Ayush, subject expert, WHO Siddha Terminology. Then subject expert, intellectual property rights, traditional knowledge, subject expert, traditional knowledge, digital library project, CSIR, and subject expert, VSS THP, Qualities Control, Council of India. So, and Dr. Thirunarayanan is the secretary of Center for Traditional Medicine and Research, CTMR, an NGO. CTMR functions in the traditional healthcare space, and Dr. Thirunarayanan and his team focuses on treating life cycle disorders in lifestyle disorders like diabetes, hypertension, arthritis, immune-related diseases like bronchial asthma, and skin diseases, and provides palliative care for cancer through traditional medical wisdom of India. I'm using this platform to welcome our eminent faculty, Dr. T. Thirunarayanan, for handling our session today. And today he'll be dealing with the standard treatment protocol in the system of medicine for common ailments. And today's topic is based on fevers, gastroenterology, and also respiratory disorders. And on behalf of Siddha Practitioners Forum, I welcome him wholeheartedly on behalf of all the members of this group. Welcome, sir.
Good afternoon, everyone. Am I audible?
Audible, sir?
Okay, good. See, this topic is very important and significant because one of the common complaints that we get from the public is if you have two economists, there will be 3 opinions. But if there are 2 Siddha physicians, there will be 10 opinions. For the same condition, different Siddha physicians will give different suggestions. And even among those 2 Siddha physicians, they will change the stand every now and then. That is one of the critical parameters why Siddha is not included in any of the insurance schemes, though certain things have been included, recommended by the National Institute of Siddha and insurance companies are taking up them now. This is the common complaint that we have been facing in the past 35 years of clinical practice. So what we did was, we wanted to develop a standard treatment guidelines. So let me explain to you what is the standard treatment guidelines in the next slide. So this is not the standard treatment guidelines of Government of India, but what I am going to present you is the standard treatment guidelines of the Center for Traditional Medicine and Research Chennai. Why it's significant is Center for Traditional Medicine Research, the clinicians in CTMR has got a aggregate clinical experience of over 100 years. For example, me with 34 years, or President Dr. Bhatnapriya with 30 years, and Dr. Sangeeta with 17 years, Dr. Ashwini with 16 years, and all the sum total of all the experience, clinical experience of all our supporters and well-wishers, we have over 100 years of clinical experience, both in the government sector, in a private prestigious medical college, like Christian Medical College, Vellore, where I have worked, and we have been running 2 Siddha health centers, one in the rural area and other in the suburban area within the city at Chinnandi Koppam and Velangadu. And we have been doing 2 mobile clinics again in Krishnagiri district, and 1 free clinic, charitable clinic in near Bommudi in a college called Sardar Niketan College in Kanavai Pudur in Dharmapuri district. So we thought wherever Siddha patient goes within our group of institutions, and each of us also have a private practice. So wherever patients go within this CTMR network, irrespective whether they are paid patients or free patients, they should get the same kind of treatment approaches. And that is why we developed a standard treatment guidelines. Now let us go into the definition of what is a standard treatment guidelines. Some people call it as a standard treatment guidelines, or the standard clinical pathway, or the standard treatment protocol. These are all systemically developed statements that assist a prescriber on deciding the appropriate diagnosis, appropriate treatment in any specific clinical condition. For example, if you go to the institute where I work first, Christian Medical College, Vellore, there will be a handbook for physicians. There will also be a desk book for pediatricians. That means across Christian Medical College, Vellore, whether the peripheral centers or the main hospitals, the treatment protocols will be well defined, and any doctor who attends to the patient will follow that same protocol. There will not be any deviation. So this, how do we achieve the standard treatment protocol? It's not somebody like Thirunarayanan deciding upon what is to be used, how to diagnose a disease or how to treat a patient. It is usually reflects a consensus. That is, everybody sits together and decides what is the optimal treatment option within a health system. For example, if I'm treating a patient in a primary healthcare unit, what should be the treatment approach? If I am treating a patient in a private clinic with limited resources, what should be the treatment approach? If I am treating the patient in a hospital setup or a daycare center, what is the treatment approach? If I am treating the patient in a peripheral hospital, what should be the treatment approach? If I treat the patients in a tertiary hospital or teaching hospital, what should be the treatment approach? What medicines you prescribe in the health center or first aid cannot be the same treatment that you give in the teaching hospital. Hope you all agree with me. So each of them have to determine what level or stage of patient that a primary health care center should treat, a taluk hospital should treat, a hospital should treat. And this is evolved by way of mechanism of consensus, considering the resources available, considering the optimum treatment approaches that are possible, and the maximum benefit it should provide to the consumer or the patient, and it should also be influencing the prescribing behavior at all levels of care. That is very important. See, in a country like India, which is a developing country, and you know the resources which are very limited for doctors, even in the primary healthcare setup in the government. For example, we got Siddha Formula of India. We also have an essential drug list. Recently, the essential drug list of Siddha has been revised from 300 and odd medicines to 200 medicines, which needs to be mandatorily available in any healthcare systems. If you have not gone through the essential drug list of Siddha, please go through them. The treatment protocol should always be within this essential drug list and also within the Siddha formulary of India. It's not that you cannot deviate from that, you cannot choose your own medicine. That should be to the barest minimum and based on the requirement of the patient, clinical conditions. Then only for health managers or policy makers, that could be a kind of uniformity. Only when there is a uniformity in the treatment approaches of Siddha physicians across the country, then people will recognize us as a system of medicine. Policy makers at various levels are therefore engaged in designing cost-effective health interventions. This is one of the important factors that we have to key in. For example, when I was running a free clinic or a mobile clinic, charitable hospital, it is very important for me also to consider the cost benefit analysis. The cost at which I treat the patient should be, number one, affordable when it's free clinic for me. When I say me, it is CTMR, or when it's a paid clinic, it should be affordable for the patient. If I prescribe a medicine that is available only by one company or one brand, and if that is costly, it may not be available across the country. So the patient, it will become inaccessible or unaffordable. But whatever medicine that prescribed should be available, accessible, affordable, acceptable. All these four criteria have to be taken into consideration when you develop a standard treatment protocol. Hope you all will agree with this concept. See, today, the biggest challenge for a scientific, well-trained, institutionally trained Siddha physician is the set of quacks who run chain clinics, who offer package of medicine ranging from 10,000 rupees for 15 days to 30,000 rupees a month. We qualified physicians cannot do that, cannot offer to do that. And we always believe, the Siddhas believe, service to the humanity is a service to the Lord of Lords, and devotion to the people is a devotion to the Supreme Self. So we believe in karma theory, we believe in Saiva Siddhanta theory. So therefore, we have to believe that the best possible for the patient should be provided at the lowest cost. That is where the role of a standard treatment protocol comes in. Standard treatment guidelines, also known as treatment schedules, treatment protocols, therapeutic guidelines, clinical pathways, and so forth. And the preferred drug and non-drug treatments is very important. I will explain to you later on what is non-pharmacological approaches to treatment. We generally know the Patya, Apatya, the physical manipulation therapy, the Varma therapy, where we use less of medicines or no medicines in some cases, or non-pharmacological in nature. The lifestyle interventions, the sleep interventions, the rest, the physical posture interventions, all of them come under non-drug treatments. Non-drug treatments have equal importance like the drug-based treatment. Very unfortunately, in Siddha system, we have been taught to believe that higher medicines that you use, the first aid medicines you use, the inorganic medicines that you use, you are a better physician. And the learning that you should spend more time on preparation of medicine. But actually, the non-drug therapies have equal or even more importance than the drug-based therapies, right? So the treatment standard guideline provides a tool for the healthcare providers to standardize on quality at an affordable cost. The moment you standardize on the quality of medicine at an affordable cost, or quality of treatment at an affordable cost, then more and more of people will move towards traditional medicine, more particularly our Siddha system of medicine. Let me brief on non-pharmacological treatment or intervention. See, for an asthma patient who comes to me, the first thing I ask them is how frequently you clean your pillow covers and the bed sheets. How frequently you clean the air vents of an air conditioner. Whether you have a pet at home, whether you have birds in your balcony, more particularly the pura, pigeons, or whether you have got any pollens or garden flowers around your home for which you are allergic. If you avoid many of these causes, one by one, probably the patient may not require a drug-based treatment at all. So, for example, again, in gastritis, this is the two topics that we are going to discuss. There I will elaborate. I'll give you a brief example here. A non-oily, non-spicy, non-pungent food, a non-alcoholic beverage, or a non-carbonated drink, like, Pepsi or Coke. Avoiding all these things may give a better relief, like avoiding smoking, avoiding alcohol, or non-steroidal anti-inflammatory drug, or regulating the quantum of aspirin for a blood thinner may give more benefit than how many herbal medicines or synthetic medicines that you give a patient for gastritis. So taking into consideration the non-pharmacological treatments play a very important role. A change in lifestyle. Suggest a person to go for walking for 30 minutes, expose himself to sunlight. See, when you treat patients from other countries, which is cold, and during winter, you will realize the cases of depression will be very, very high. The cases of depression will be very high. So simple exposure to sunlight or walking for half an hour will greatly relieve the depression. So this is what we want our doctors to suggest. Generally speaking, it's only a comparative degree. I'm not comparing modern medicine doctors to things. Compared to a neurologist or a Siddha physician, this much more advices on healthy lifestyle, healthy diet. We should use it as a strength for our non-pharmacological treatment. Use of physiotherapy, exercise, provisions of adequate psychological support is very important. On this, for 13th of January, I was invited by the Dean and the Red Cross Society of the Madras Institute of Technology to counsel 100 students who had tested positive and who have refused permission to go back and travel to their homes You know, in Tamil Nadu, Pongal is a very important festival that for the rural community. So when you stop the students from going home, that itself causes a lot of psychological disturbance for them. Plus, added on the positive COVID status. So the 1 hour of counseling, which I was able to provide, definitely gave a lot of relief to the student community, which gave me a good feedback after this event. So psychological support is something which is very important that we need to give when it's required. So these are our non-pharmacological treatments. This also includes our Varma and Pakanam, where we don't use any oils or any kanjis or any, because kanji we consider as a food, but all Varma kanjis also contains herbs which have a pharmacological activity. That we should always remember, right? So these have some importance as a prescription of drug, and instructions must be written is very important. Whatever instruction that you give your patient, you should be written down. It should be explained, and you need to monitor them. That's very important. See, we just suggested something to somebody. I've known doctors from US who used to tell me, or even patients from US used to tell me, the doctor's office will send a message after 15 days, after a month, after 3 months to know your health status, whether you are following the compliance, what you call as the patient compliance. So the monitoring is also important. When you give an instruction, it has to be written down on a prescription pad or the note, and also the explanation, a detailed explanation of what is to be done. Many times they feel, moment you prescribe a suggestion, they feel that they know it. The moment they go home, after 2 days, they forget it and they call back. Either you should have a patience to explain to them, or you should ask them to read what you have written in a legible handwriting, unlike mine, and also explain to them when it is required. What are the common ailments for which people come to Siddha doctors? Fever, malaria, dengue, ordinary flu, chikungunya, typhoid, and now COVID-19. Common cold, sinusitis, tonsillitis, bronchitis, bronchial asthma, COPD, then anemia, jaundice, non-alcoholic fatty liver disease. If anybody goes for a scan after the age of 40, 45, most often one of the findings you will find in the ultrasonogram report is non-alcoholic fatty liver. And with the changing times, changing food habits, lifestyle, GERD, gastroesophageal reflux disease, is, see, when we were students, we were seeing more of gastric ulcers, peptic ulcers, perforated ulcers. But today, after 25 years in my practice, I rarely see any perforation or ulcers, because the awareness has also become higher. When the first sign of gastroesophageal reflux disease or gastritis, people come to doctors and seek their opinion. Diarrhea, dysentery, food poisoning, irritable bowel syndrome, hemorrhoid, Fisheri nano, perianal abscess fistula, myalgia, what we call in K3 syndrome, Kaigal Kodachal syndrome, or GOK syndrome, God only knows syndrome, arthritis, diabetes, hypertension, eczema, psoriasis, vitiligo. Now dyslipidemia has become a big problem. People come to us for dyslipidemia also, and infertility in other areas. They also come to us. DUP, PCOS. I am not covering this in this topic mainly because there is another expert from CTMR who will be covering all the gynecology and obstetrical conditions. Now let me get into the topic straight. Fever. I'm not going to describe about the symptomatology or the classifications widely which is in the text. I am going to talk about more of clinical experiences, practices, that a clinician in a consulting chamber or in a small daycare center will be able to do, right? So any elevation of body temperature, it could be continuous or intermittent or what we call as remittent, disappearing and appearing again. The oral temperature of a healthy adult in centigrade is 36.8. But in children, usually the rectal temperature is taken as 38 and the oral temperature at 37.8, 1 degree more than adult temperature. And axillary is 37.2, that is 99 degrees in the axillary region. It's not considered as a fever. Only when it exceeds 99 degrees, it becomes fever. A fever of 41.5, that is 104 or 106, is considered as hyperpyrexia. In most of the fever, it is the myalgias, arthralgias, anorexia, nausea, sleep disturbance, chills, rigors, sweats, depending upon the clinical condition. These are the general features that I am talking about. Change in mental status and skin rashes are the common symptoms in fever. Skin rashes, when I say skin rashes, it is the exanthematous fevers. Right. So in a clinical setup, see, we Siddha physicians generally go by a clinical acumen, that is the 3 stages that you well know. Hands first and the most, eyes next, seeing, touching, and then asking by mouth the history. Eyes first and the most, hands are next and little, and mouth never and the last. So we go by clinical features mostly, but it doesn't prevent us to go for diagnostic tests. A complete hemogram with the elevated ESR will give guidance of inflammation or other underlying cause. A peripheral blood smear during the fever, when the temperature is high, will guide us to malaria and filaria. Urine analysis for urinary tract infection, Vidal test for typhoid, X-ray chest for any COPD or tuberculosis, a low-grade fever, any abdominal fluid for infection in the abdominal region. Now we add to this test the pulse oximeter test for COVID and also do the RT-PCR for COVID. So rapid antigen test is also the other set. The confirmatory is the RT-PCR. And when the lung involvement is there, fortunately in the third wave, there's not much of lung involvement. CT scan became a main issue in the first 2 episodes, or what we call as the waves. See, routine use of antipyretics. I still remember when I was 23, 24, I started working in Christian Medical College, Bello, in the community health department. The doctors will never rush to an antipyretic. I'm not using the name, you all know. In the third wave, it has become the national medicine, like national flower, national bird, peacock, national animal tiger, national medicine has become the Doro 650. I don't want to use the name, but still, people have started abusing it left, right, and center without consulting any doctor. So, in CMG Vellore, when somebody reports with fever, they never used to rush to medicines, antipyretics. At best, they will ask a chill water soaked cloth to be put on the forehead or reduce the body temperature by non-pharmacological treatment, what we call the hydrotherapy with tepid water and lot of oral fluids. Here also in viral diseases and COVID and other conditions, prevention of dehydration, in dengue more particularly, prevention of dehydration with oral fluid, drink more of water, take adequate rest so that you don't get arthralgia, myalgia. So these are the non-pharmacological suggestions that were done, and never rush to the oral low antipyretic even for a low-grade fever. See, when do you call the fever as a fever of unknown origin? See, forget about this 2 years. We have been getting COVID, we have been getting dengue, we have been getting chikungunya patients at random. In fact, if somebody is following me on WhatsApp, from November onwards, I have started putting out on dengue, warning on dengue. Similarly, in parts of Kerala, come monsoon, November in Tamil Nadu is because we get rain most of the rain in the northeast monsoon, especially in North Tamil Nadu. Maybe the Western Ghats region get rain around June, mid of May. The southwest monsoon starts in Kerala, and beginning of June, July is the time that we get maximum number of dengue from across the border. Nipah, you all know, but it is short-lived. Ebola is short-lived, right? So similarly, when you are not able to identify cause, then only you have to call it as a fever of unknown origin. The maximum efforts that you should put is to understand what is the cause of the fever. If you look at Siddha literature also, there are 52 intrinsic causes and 12 extrinsic causes which they classify the fever. Modusuram, Muraisuram, right? Various type of fever. Bayachuram, Nachichuram, toxicity, fear psychosis, fever due to fear psychosis, and various things are defined. Only when no allopathic approach to diagnosis is possible, then only you should get, because in Tamil Nadu there is a craze. People classify Juram as what? Marma Kachal. I don't know whether they use the term in Kerala. Here, even the general press media, even if sometimes the government have been using the term Marma Kachal. But that is not fair. Only when you are not able to identify the cause, because the treatment is not the same for all kind of fevers. That is very important. I'll come to that little later. The investigation is to be done in every patient with prolonged fever. Yeah, when I talk about fever of unknown origin, normally it is prolonged fever. We have seen patients with 15 days of fever, 30 days of fever. Even after doing all the tests, they are not able to identify the cause. That is what we call a fever of unknown origin. Complete hemogram and the peripheral blood smear for malarial parasites. Even patients with leukemia, Hodgkin's lymphoma, you will find this cause of the fever from the blood picture. So it's very important to look at the complete hemogram, essentially. The platelet count will enable you to decide on the dengue fever, dengue hemorrhagic fever to more particularly. Liver function test on amoebic liver disease or infected liver disease. Tuberculosis test, X-ray chest, right? Ultrasonogram abdomen, computer-aided tomography, CAT scan, sometimes a biopsy, FNAC, fine needle biopsy, right? Treatment will depend upon the cause, right? So you cannot treat every patient the same. Symptomatic treatment for fever is sponging with lukewarm water, giving adequate rest, giving adequate water. If it's a viral fever, giving adequate food is very important. Non-oily, non-spicy, non-fat-rich, simple food. That's why what we call Utta Churathirkum, Uriyam Vayivirkum, Atte Varumattum, Annathai Kattade. I know I am jumping into Tamil, but there is no direct thing that can explain this much better. Remember, they only say Atte Varumattum, Annathai Kattade. They suggested you not to give the whole rice, but they never suggested you to prevent you from giving liquid food or porridges, kanjis. That is why even the other proverb that we commonly use. What? Langanam Parama Aushadam, Lagu Unavu Parama Aushadam. The same breath. When they say Langanam Parama Aushadam, Langanam is not complete fasting or starvation. Lagu Unavu is the method. Lagu Unavu is what? Giving simple, easily digestible food is the Lagu Unavu. Lagu Unavu Parama Aushadam. Like, okay, malaria, I don't know how to explain. Wherever there is water stagnation, one of the non-pharmacological interventions we always suggest is not to allow water to stagnate. In monsoon season, wear a fully covered, full cuff cloth. Don't use, half shirts or t-shirts during monsoon because of mosquito bites. And wherever there is a prevalence of mosquito in the coastal region, you are expected to use your mosquito net, more particularly for the children. These are all non-pharmacological interventions that a Siddha doctor should also advise. Non-stagnation of water. We also have the fumes of nochi and all other things that are also non-pharmacological interventions. We also know about falciparum malaria. So, the diagnosis by the thick and the thin blood smear. The thick film. The blood films may be negative even as a severe attack because of the secretion of bacteria, and that is why we talk about the thick blood smear. There are also rapid diagnostic kits that are available for falciparum malaria. What is the drug we use? Svechia chirata. What is Svechia chirata? It's Chime in Then Cisalpinia crista, Kalachika in Tamil, Kuberakshi in Sanskrit. Alistornia scholaris, Yedile Palai or Saptabarani in Sanskrit. I am using both the Sanskrit words because some of you are familiar with that only more. Picruja chlora is Kadagaroini and Kutki in Sanskrit. See, let me make it very clear as a practitioner. As long as the herb also belongs to Siddha and Ayurveda, you don't have to have any reservation of what to use. A rose will smell sweet by whatever name you call it. You call it as gulab, you call it as roja, or you call it as what? Rosa damascana, the rose is going to smell sweet. So similarly, we don't have to have a reservation just because some other Ayurveda company is making this. These four ingredients are the famous formulation which was given from Sagasha Yoga, which is more popular in Kerala and in Kanyakumari districts of Tamil Nadu. And the person who suggested this combination is none other than the great Ayurveda physician who first worked in the WHO as a consultant, who was an advisor of Ayurveda in Government of India, who was the Vice Chancellor at 84, in the 84 means his age, at Gujarat Ayurvedic University, Dr. P.N.V. Kuru, from the suggestion given by his father, who is also a Vaidya. This is the medicine that is called as I-64, which stands the test of time. And even now, Ayurveda physicians have no reservation in prescribing a medicine in COVID. Svechia chirata, Cisalpinia crista, Alisona scholaris, Picrosia cova. Chime Ilavembe. If you look at the original text of our Kabajura Kodini, you will not find Ilavembe, but Chime Ilavembe. If you look at the 1971 publication of IMCA, the Formula of Siddha Medicine, it will be clearly written as Chime Ilavembe. Whereas now, we are using the not Ilavembe. Right? Why Picrosia cova is 1/4 part is because it's a hepatoprotective. There will be a hepatosplenomegaly in malaria in most other fevers, and therefore you require a hepatoprotective. It also prevents constipation because of dehydration. That is why Kadiga Rogini or Kutki is used. But since it should not further dehydrate the patient, that is why it is used at 1/4 of the part, while all other ingredients are 1 part. See, when we write the standard treatment protocol, it's very important for us to know the ingredients on each formulation. Then only we know what kind of activity they deliver. Cystialpenia crista, you all know, is an anti-inflammatory. Swetia chirata is an antiviral antipyretic. Allistonous cholera is an antipyretic. Picrosia crura is a hepatoprotective and a laxative or purgative, I would say. So that is the reason why they decided on this combination for malaria. As a clinician, I was working or practicing in the coastal belt of Tirvanmiyur, Bedannagar, Hinjambakam. Our free clinic was near Hinjambakam. You know, you all know by the DGP Beach, Cotton Beach, or East Coast Road. There used to be a lot of malaria patients at some point of time. Like Kalahandi district in Orissa, Koraput, Kalahandi district of Orissa, used to get a lot of malaria patients. So this is the formulation that we use. Unfortunately, for past 20-25 years, the 2 brands of medicines commercially available, Antimol and MT6, was not available in the market. With all 64 being promoted, now many companies are again getting the license and started manufacturing. But for us, Swetia chirata, we can get in the shop. Guberaksha Karachika, we can grow and have the seeds. Pattabarani, we can get the sleeves. Kutki, we can get from Himalayas. So we can make a blend of ourselves, keep it for our practice, and use 2 grams every 6 hours. In case of falciparum malaria, not in other malaria, we have to treat the patient for 21 days. If you look at the modern medicine also, the filarial cases and malarial cases, they don't stop with one. Of course, they also use quinine derived from cinchona bark. Which malaria drug is the one which got the Nobel Prize for this Chinese researcher. So we know of cinchona. Cinchona is also an ingredient in your Magga Sudarsana tablet. That is why in early phases of corona, that is March 2019, 2020, our doctors are prescribing more of Maha Sudarsana Matra. Dengue is a big challenge both for people in Kerala and Tamil Nadu. Though we have not been highlighting a largely, this year we had more dengue cases than the previous year. And it was a nightmare for practitioners like me because people get admitted in hospital, and from the hospital bed, they used to call me for anti-dengue treatment. And there were youngsters, there were elderly, there were pregnant girls who were all affected by dengue disease starting from November 2021 till January 2022. So we had a big challenge at hand, and we used to treat a lot of patients who were in the hospital beds. Unfortunately, many hospitals, private hospitals, even in places like Vandavasi, Trichy, Salem, Erode, allowed the patients. You take the medicine given by your Siddha doctor, and only for hydration. If you are not able to take oral medicine, we will give you IV fluids. So IV fluids are given by them, oral medicines are given by us, and most patients recovered in 2 to 3 days. We have seen patients whose platelet level dropped to 20,000, 25,000. Most of the patients who approached us were in the hospital for 4 or 5 days, and only after the platelet count came down to 30,000, they thought of an alternative and came to Siddha. In spite of the fact our state government have been aggressively promoting Siddha treatment for dengue, chikungunya, and viral fever, many patients are blissfully ignorant, and one of the causes is also because we are not able to provide nilotinib to everybody because of the 9 key ingredients. One is the Trichosanthus marina, Pudal, we call it in Tamil, and Patolam in Sanskrit. And sandalwood, many people did not have the license, so they were not making the Nilevemukudine with sandalwood ingredient. So that was also a challenge. So the dengue hemorrhage fever, all the patients we advise, if there's any oral bleeding from the gums, if there's any petit hemorrhage, when there's a tourniquet test, you apply the tourniquet and see if there is any red spots, or if there is bleeding from the urine or the stools, or oral bleeding, even the smallest traces, you should immediately report to us. The treatment for dengue fever is different. Dengue hemorrhagic fever is different. Dengue shock, we did not see any patients in this season. You know, the diagnosis is by the immunoglobulin test. The complete blood picture gives you an idea, and the tourniquet test gives you an idea. The grade, I am not going to go into it because we are already running out of time. And the non-pharmacological treatment. The bed rest, oral fluids, ORS. When I say ORS, it doesn't mean the salt sugar solution. The one teaspoon of salt, 4 teaspoons of sugar, and 1 liter of water. It is not that I mean. ORS could be rice-based ORS, arsi vadicha kanji, or even the simple kanji, where you add omam, where you add jeeragam in fine powder form and little salt. You know, the rice gives you the starch. And every house will have this nonjersi or arzi. The rice gives you the starch and the complex carbohydrate. The salt, the stable salt, which will be at home, provides you the sodium requirement, right? And the cumin seeds and the the adjoint seeds take care of the vomiting, nausea, diarrhea kind of feeling, and that will help the bacterial mistake also to some extent. Nilavemukudine. See, by formulation, not formulation, formulation is the same as in the Siddha formula of India. My way of making it is only 2 grams. Because we have coarse powder now. Unlike earlier time we had kattais, wood pieces. We have fine powder and coarse powder now. And boiled in 60 ml of water in a closed container. When I do large scale intervention, I use a pressure cooker, a 12-liter pressure cooker, where I add 600, 800 grams of nilavembu, rest of that water till 10 liters, and use the lid of the pressure cooker and put a weight. When the second whistle comes, I take it out and filter. I have compared this filtered nilavembu, which you can prepare 10 liters in 5 minutes, with the standard nilavembu that is made by others, and you run a TLC or HPTLC and HPLC, you will get better images in HPLC because the volunteers will not have moved out because you have used not only the temperature but also the pressure, and you are covering is the lid. Therefore, the extraction will fall superior than the extraction that you do it in a open boiling and boiling for so many hours to reduce to 1/4. The most of the actives evaporate. We have to marry science with traditional knowledge. This is a simple way of making nilavembu. We use sometimes Adadara kudini when they have cough and fever. Adadara kudini also improves the platelet count. So we use a combination of nilavembu and Adadara kudini, or nilavembu and manjista quadrichorum. See, quadrichorum is decoction powder. Don't use the ready-made liquids. My dear Kerala friends, the ready-made liquid, they are selling bottle, they are selling water to us. And if you boil any herb and keep it in a container, even in anaerobic condition, that is sealed condition, there is every possibility that will turn into an acidic fermentation, causing severe gastritis. So I plead with you, any day, you use 2 grams of powder and boil yourself and ask the patient to consume. Don't buy the Quada sold as such in bottles. And don't believe in the syrups. Syrups are 60 to 70% water, 20 to 25% sugar, and you have traces of curves. So only in children there is no other alternative. Not even children, in infants. That is 28 days to 1 year. Generally, first 6 months you don't give any medicine, give medicine only to the mother. So syrups are limited to a particular age group. It applies to Aradodai syrup also. You know why? Aradodai syrup made by the companies contain only Aradoda. But the traditional Aradodai kudini, that is in practice from the oldest Siddha Medical College, that is the Thirunarayanan Medical College, which was started in the year 1964, when I was born, uses 4 ingredients, namely Aradodai, Adimaduram, Tippili, and Talsapatri. These 4 combinations is an excellent combination. I tell you, Aradodai is a bronchodilator expectorant, you all know. Tippili is an antibacterial. Even in tuberculosis bacteria, it is very effective, right? It's a bronchodilator. It is an antihistamine, anti-allergic, mast cell stabilizer. Tarzopatram is something that you use in cancer also. Taxus baccata is the Taxol, is the compound that is used in cancer also. That means interleukin cytokines in corona. And Yashimadu, we simply think it's a sweeter, a taste mask. But actually, extreme Madhu is a very good antiviral against corona types of viruses. It has been proved time and again in 2002 and 2013 when SARS and MERS virus affected people in large numbers. Right? Coming to chikungunya main feature apart from the other common feature is the arthralgia. So for arthralgia, like for malaria, I gave a different formulation. For dengue, I gave a different formulation. For chikungunya, my focus will be on the nut grass. Apart from Nilavembu, though Nilavembu also contains nut grass. What is nut grass? Coracalangus, Cyprus rotundus, right? Coracalangus is a powerful anti-inflammatory and anti-myalgic. In a temple called Sri Mushnam in Kadalur district of Tamil Nadu, Bhuvaraga Swami is the Swami's second avatar of the wild boar kind of avatar, where the prasadam they administered every day is a laddu made up of Cyprus rotundus. Anybody who has met with an accident will go to the temple and take the laddu. Oh, that is the treatment mainly because of this nut grass. So then for anywhere, any condition where there is a severe inflammation in chikungunya or in like COVID, the interleukin, cytokine storm and all those things, there are 2 ingredients which are powerful. One is the Boswellia theata, Palimbi chambrani. The Salaki is the common name. And Commiphora musculi, Eremectin fungilum, Mahishasura gundulu. So this is what is recommended, and also a combination. I'll give you that in the next thing. Also a combination. Okay, the next slide. Yeah. Also a combination called Arathai Chukku Kashayam. You all know in the North Kerala part and the South Karnataka, South Coastal Karnataka part, Hubli, Mangalore, all those areas, they sell a Kashayam, even in hotels, which is nothing but Alcinia officinarum or Alcinia galanga, Chittavattai and Chukku. In South Tamil Nadu, we have Chukkumandi coffee, which will also have Arathai. So Arathai is a powerful anti-inflammatory, Chukku is a powerful anti-inflammatory. Sometimes for external application, we use Jivat Auja. Typhoid, you know, step ladder fever caused by salmonella typhoid. The sick look that the patient always have, the weakness, it is called as the enteric fever. Those that could be constipation or diarrhea, there could be abdominal pain, there could be tenderness, there could be hepatosplenomegaly, which I mentioned earlier. That is why I was suggesting Kianali in that. Hepatosplenomegaly is the main sign in children, and the test is the Vidal test. Okay. Then coming to treatment, the one drug which is very powerful. When I was a student 37 years, 36 years ago, me and Dr. Ramasamy, I think he's also in the group now. We went to the Tirunelveli Medical College, where the vice principal of the college, microbiologist, Professor Ganapati Sundaram was there, allowed us to do a antimicrobial study for typhoid, salmonella typhoid. The drug of choice that we chose was Brahmananda Bhairavam. We compared with the other standard drugs. Those times it was chlorphenicol and a combination of trimethoprim sulfametazole, what you call a Ceptron or Bactrim. At those times, I'm talking about 36 or 37 years ago, and this Brahmananda Bhairavam had a better zone of inhibition in the wall study where we did. So it's decisively concluded that apart from bland diet, because there is already enteric this thing, Colorina antidysenterica, Kodasapala pattai, Yeladi. What is the difference between Yeladi? Okay, when I come to gastrointestinal system, I will talk about Yeladi more. And also, this Brahmananda Bhairavam is the drug of choice in typhoid. But the same Brahmananda Bhairavam cannot be used in viral fever. Bacterial diseases are different, viral diseases are different. Though of late people have started using Vasanta Padmagaram, Brahmananda Bhairavam also in COVID, we strongly recommend in our clinical practice, I have published in Abhinava Dhanvantri and also in my blog. If you go to CTMR.blogspot.in, our experience in treating COVID is shared with you in the first wave, in the second wave. The third wave we are yet to write, but we have enough patients whom we have treated in the third wave, where we have found this combination significantly working. Non-spicy, non-oily, non-fermented food for a month. Non-sour food and juices are fine. The pulipillada fruit juices are fine. Okay, before we go to the common cold and rest of the thing, for fever, generally we get typhoid fever, flu fever, chikungunya, dengue, and now COVID. Do you think something else is left out? And I also require a 2 minutes or 3 minutes break. May I request the moderator to open the session for questions for 5-10 minutes? Some of my senior colleagues are also there in the forum. Dr. Ramasamy, Dr. Badmapriya, others will answer that. I can also join them. Thank you. Any questions, please?
Do you have any doubts? If you have some doubts, please clarify now. Regarding fever, regarding chikungunya, dengue fever, the topics so far are covered. If you have any doubts, please ask.
As usual, like everybody says, if you have no doubts, that means I am not very clear. Or you can even put your questions in the chat box. If you have reservation calling and asking questions, you can even put it in the chat box.
You can yourself unmute your status, and you can unmute and you can ask doubts if you have any. Otherwise, you can put your doubts in your comments chat box. And we are running a YouTube live channel now for the stream, live streaming this session. So if you have any doubt, you can put the comments in YouTube channel also. We will be forwarding that to sir directly, and we'll be getting the reply from sir, and we'll be putting that results in the group.
Sir,
So there is a question why Brahmanda Bhairavam is not an option for a viral fever.
see, that is what. See, anything which is an antibacterial need not have to be in antiviral also. Brahmananda Bhairavam, we have clearly studied it 35 years ago as an antimicrobial, more particularly against Salmonella typhoid. We tried E. coli, we tried other bacteria, it did not work. Of course, antiviral property, we don't have the infrastructure, only National Institute of Virology have to do that. But as far as Nilavembu is concerned, Swetia cerata and Chimenilavembu is concerned, Azimadram is concerned, their antiviral activities are well known, well proven in various kind of chikungunya virus, dengue virus, and in coronavirus. Even in COVID-19 virus. Coronavirus was sprayed during the many coronavirus. COVID-19 coronavirus also is very effective. There are antiviral studies carried out on that. That is the reason why when you have, see, we always say, when you have an optimal treatment, what we call as the right treatment. When something is superior, why do you want to choose the second best? Another reason, personal, meaning to pluck a flower, you don't require an axe. You can simply pluck it by hand. For conditions where you have simple, safe herbal remedies, as much as possible, avoid using mercurial and arsenic. My dear Siddha friends, WHO has already banned the use of mercury for general purpose. US has banned the export of mercury and mining of mercury for general purpose. The only exemption now is being given mercury is for the traditional use. That too, some people got it for making medicinal beads, got it for making the linga swarupa and other things. And the mercury cost has gone up from 3,000 a kilo to 10,000 a kilo. A good quality mercury. So it is going to be impossible for us to make medicines. For me, it's very clear, available, accessible, acceptable, and affordable. The most important thing is affordable. For an NGO like me, the medicine that I prescribe should be cost effective. Did I answer you?
Yes, sir. It was very clear, sir. Thank you, sir. Is there any other question?
Okay, we will go to the respiratory illness. Is that okay, team?
Okay, sir.
Okay.
We
See,
shall continue the session, sir, to the respiratory illness.
we'll go to the respiratory illness. Common cold. This is now, people are a bit scary nowadays. Hello. Can I continue?
Yes, sir. You can continue, sir.
Okay. There was some intervention, so I thought somebody is asking them questions. Okay. Common cold and sinusitis. Started by running nose, irritation, burning eye, fever in children. Is most important thing. The problem with this is the post-nasal drip at bedtime. What happens when the child or a middle-aged person, even an elderly, lies flat on his back? What happens is, instead of this water from the nose coming to the nasal opening, it drops in, it drops. That's why it's called as a drip, post-nasal drip. It drips, causes a irritant cough and sneezing. So that's why people say, I am all right all through the day, but when I go to the bed in the night, I get cough and sneezing. So my sleep is disturbed. So that is one of the common features of common cold that we say is the post-nasal dripping at bedtime causing irritant cough and sneezing. In sinuses, you have the pain in the paranasal sinus area, right? It could be below the eye, over the eye, or sorry, below the eye, over the eye, or in the temporal region. You will feel a pain. Then stuffy nose, nasal block, nasal obstruction. Some people come with septal deviation. This nasal block can lead to occasional giddiness, constant frontal headache. When the people go in the sun, they get headache. When they bend forward and raise their head, they get giddiness, headache, occipital headache. Then pain in the ear. See, though I write as X-ray for the paranasal sinuses, the best way is to touch and feel. To touch the, what you call as the outer canthus of the eye, above the middle of your eyebrow, below your eyebrow, sides of the nose, you will feel which sinus is affected, right? So the manual examination helps a lot. Why you require a paranasal sinuses is because the patient to understand. If you only show him the X-ray picture and show him this is where he got this thickening of the mucosa along with the foreign material, he will understand why. Because as a clinician, I always get the challenge. The people come and say, "Sir, I am a sinusitis patient." Sinusitis comes to you, do steam inhalation, treat it properly. If paranasal sinuses will get cleared, and you will become free from sinus. Next step is what when you go and expose yourself to the same kind of allergy, you get it again. It doesn't mean you can label or brand a person as sinusitis patient for life. Like any other condition, like food poisoning. You ate food, stale food in a hotel, you get food poisoning, nausea, vomiting, diarrhea. That gets cured in 2-3 days. Again, when you go to the same hotel, take the same food, or some other hotel, take the kind of food, stale food, you get back that food poisoning. So it doesn't mean you are always a patient of food poisoning. That we have to make it very clear to our patients. Non-pharmacological management is the first thing I do. Yeah, I explained to you in the beginning of the lecture, avoiding the allergy from the pillow cover, from the bed sheet, from the pets, from the birds surrounding your home, from the pollens, from the unclean window nets, from the unclean, air vents. So clean them all and use the mask. Very important. See, in a patriarchal society like India or Tamil Nadu, usually the dusting, the water radical they call it, no. So that is being done by women on Thursday, the day before Friday, where they clean the house properly for puja. So when they do that, most of them get sneezing that night and they will not be able to get up for the prayer in the Saturday morning. Though the problem is, the mask is not just for corona, COVID. Whenever you detest any region, you are expected to use a mask. When there is fumes, like for example, in urban area, semi-urban area like ours, some neighbor will burn out all these unwanted leaves. They don't compost it. You can simply compost it at your home. Use it as a fertilizer for your garden. But very unfortunately, people love making fumes and they burn it. And that fumes and dust, even sometimes the dupa that you have to at home, can cause that kind of an allergy. So very important is to avoid these kind of allergens. When it comes to drug, Neetkovi Matre application is very, very helpful. 2 applications helpful. Unfortunately, I think some companies are now coming with 6 packs. Otherwise, they used to come only with the 50 packs. So once they use it, rest of the 40 tablets goes waste. So people are reluctant. Then the best medicine that helps in sinusitis is the 3-Kataguchuranam. 2 grams in honey after food. So this is very critical. Why I say after food? 3-Katu is spicy. Chukku Madaga and Chippi. Kurumadaga. You are used to Kurumadaga. You have Wayanad ginger or you have Chukkumaran ginger in Kerala. So you are familiar with the use of this more than us. Though you call it as what? Chukkilla Kashayamilla. Here we say Chukkilla Marnilla Subramanian Minja. Right? So similarly, it's always taken with honey. 3-Katu being spicy, always taken with honey, particularly in children and after food. Very important. And I have seen a lot of people who have an allergic tendency taking it for a mandala, 30 days to 45 days, twice a day consistently for the next 1 year, till the next season or even beyond that. Don't get this kind of an allergy. Yeah, using mask, protecting yourself, avoiding this important non-pharmacological. But once you have a tendency in yourself, a family which has a genetic history, then you have to take 3-Katu Churanam. Aradhara Kashayam is very important. Yeah, here you can use the ready-made Aradhara Kashayam. Now, fortunately, after my request, IMCOs have come out with the prepared Aradhara Kashayam. They were having only the syrup. Last 1.5 years, they have started preparing the Aradhara Kashayam the way in which it was made in the college. Aradhara, Adimadram, Asitipli, and Talsabatri. And SKM also prepares. The problem with SKM is they have 70% of Aradhara leaves and less of other ingredients. Therefore, it is too bitter for children to consume. You can make Aradhoralam and Siri Aradhoralam, you always grow in Kerala. Most of you will be having a garden in a neighborhood. Wherever I travel, I've seen all my Siddha doctor friends having some kind of a plant. Few herbs at least. So you can use 1 leaf. Very important for an adult. Use a mature leaf is only 1 leaf. If you start giving more than 1 leaf at a time, they start vomiting. And peppercorn, don't use whole pepper. Use a peppercorn powder. Again, boil it for 60 ml and half the dose. In children, always use honey or pan jaggery or even licorice powder, which gives them the kind of sweetness to beat the bitterness of the taste masker. And all the 3, honey is also soothing, licorice is antiviral. Yes. And there are 2 excellent herbs that I don't think we extensively use. Do we use Vilva leaf and Kapuravalli as frequently as we use? No. So they say Ege Vilnum Sivarpanam. So the Vilva leaf is such a good anti-mast cell stabilizer, anti-allergic, like the Coleus ammonicus, Kapuravalli. Los Angeles like Talisai Vadagam Google. Chukutta Ilam, both for hair as well as Nasiam. There are different Thailam which are mentioned in the Siddha literature. Pinisat Thailam, Chukutta Thailam, Nasi Roga Nasi Thailam. But still, in my clinical practice, I found Chukutta Thailam to be more handy because one for both your application, you can either apply as the oil before hot water bath if you have severe sinusitis or use a drop in your nose. So I cannot ask the person to carry 2 Thailands as a practitioner. See, bronchial asthma. I'm not going to discuss about renal asthma, cardiac asthma here because we know to distinguish between a renal asthma, cardiac asthma, and the bronchial asthma. This bronchial asthma is a chronic inflammatory disorder which narrows down the bronchus in response to an allergic reaction. This occurs to people who have hypersensitivity. It could be episodic, variable. Somebody may get every day, down the year, or somebody may get at a lesser frequency, or somebody may get it only when they get exposed to the thing. The typical sign is the wheeze, the musical sound, right? Shortness of breath. Some people may not have the breathing down, but they will complain of shortness of breath. That is what, when we complain of shortness of breath, you should know to distinguish between cardiac conditions and the respiratory condition, or the COPD like a condition, or like COVID like a condition. And that is where this pulse oximeter comes into very handy to know what is the oxygen saturation. Some people do not have any of the symptoms, but they have a Tyson test. You always remember, in a clinical setup, you don't get symptoms or signs which are described in the textbook. And no person comes with a single condition. Some patient who has got a irritant gastritis will have a retrosternal burning, or will have always a kind of a sore throat that may mimic a respiratory condition. Hoarseness of voice. He may get cough, instant cough. That could be because of the gastrointestinal symptoms and not necessarily because of respiratory symptoms. The nausea may occur in cervical spondylosis. That should be distinguished from the nausea that you get from the gastrointestinal condition. So these are all something that we need to take adequate care. And the cough is a non-productive cough. Unproductive cough are with a tenacious sputum, very little of sputum. Where in COPD, you get copious sputum. In tuberculosis, you have blood-stained sputum, low grade fever in the evening, and also loss of appetite and weight loss. Okay. The wheeze could be diffuse, bilateral, and there could be also inspiratory and cacophony. Helpful information is the family history, personal history, exposure to any allergens, and you all know eczema, hay fever, urticaria, asthma, all the four come together. Eczema, hay fever, urticaria, asthma. So any asthmatic patient look for a skin lesion also. Any skin lesion patients look for a asthma also. When the first sign of allergic rhinitis, you start treating them. Very important, when there is a intake of aspirin or non-steroidal anti-inflammatory drug, the asthma gets aggravated. The asthma gets aggravated with the use of beta blocker drugs as in hypertension or in glaucoma drops. Glaucoma drops are also, glaucoma is the increased intraocular blood pressure. So intraocular pressure can also they use the beta blocker, what they use in cardiac conditions. So there also you have to check for the history. Pollens, dust, animals, exercise, viral infection, chemical irritants. I have discussed about all the things. The differential diagnosis I have discussed mostly. Treatment, non-pharmacological is identify the trigger and avoid the trigger. This is the first point in any disease. First, understand the cause and try to remove the cause, or understand the triggering factors, remove the triggering factors, understand the exacerbation factors, remove the exacerbation factors. The first and foremost is avoiding the triggers. Second is the breathing exercise, pranayama. Third is reduce the weight. Many obese patients have a snoring feature and also an asthma. So weight management, obesity management with gardenia, caroloma, cumbreata, that will come to you later. Some of the drugs are very helpful. Again, Aradora Kashayam, and Ciprofloxacin are the mainstay drugs in my clinical practice. It may look simple, but the simple medicines are always the greatest. And any medicine which contains berberine, Berberis aristatum and Coccium fenestratum. Can some of you unmute your mic and answer what is Berberis aristatum, what is Coccium fenestratum? What is in Kerala, what is in Himalaya? Am I a little faster?
No, sir, you're clear, sir. We are
Hello?
able to follow. Yeah, we are able to follow, sir. No problem.
Okay. See, Berberis aristatum is Maramanjal, which is grown in Himalayas. Coccium fenestratum is grown in Western Ghats, Kerala, which is Kodi Manjal. Actually, we substitute Kodi Manjal in the place of Maramanjal in all our formulations, whichever is made in Ayurvedic industries in Kerala. So there is a distinction between Svechia cerata and Androcavis paniculata. There is the difference between Costus speciosus and Sarsodia lepa. That is why I was against Kabajura Kudini, because Kabajura Kudini, the original ingredient Sarsodia lepa are the Jadi Koshtam. But what we are using is the local Koshtam. Each of the drug I can explain later. Okay. It's very important. The interleukin 6 cytokines, whatever is the cause for inflammation, for cause or triggering changes that occur in cancer, also occurs in bronchial asthma. So therefore, the Boswellia serrata based drug is very effective. Eagle marmeos, Vilvum, the leaf of Vilvum, the bark of Aringium salvifolium are all very good mast cell stabilizers, and Coleus aromaticus or Coleus ammonicus. I think you know the difference between Karpuravalli and Omavalli. One that smells like ajwain is Omavalli, one that smells like camphor is Karpuravalli. The chemical compound varies between the two. The ajwain contains thymol, Omavalli contains thymol, while Karpuravalli contains camphorol. They are not one and the same. Sometimes GERD, I told you in the beginning, also can cause this kind of asthma allergy, because when there is a gastric irritation, it will irritate the diaphragm which is just above that. So when there is a limitation in the movement of the diaphragm, there will be a pain in the costochondral junction that can also limit the expansion of and constriction of the lung, respiratory pathway, what we call as the supportive muscles of the respiration. When there is a gastrointestinal irritation, that can also cause irritation, limitation in respiration, and trigger bronchial asthma. Okay, anemia I will skip because I have not included in today's session. And now, so when it comes to respiratory illness, allergic rhinitis, common cold, tonsillitis, and bronchial asthma is what people come to Siddha mostly. I have not touched upon tonsillitis, but I can suggest you extempore. You know, tonsillitis is inflammation of the tonsils, and tonsils are nothing but specialized lymph nodes, like adenoids, tonsillitis. So there's a common joke which used to prevail in our time. Like if a pediatrician opens the mouth, he sees 2 tonsils. And if an ENT surgeon opens the mouth, he sees 40,000 rupees. What does it mean? Most of the ENT surgeons will suggest you to remove the tonsils. Unless the tonsils are inflamed, pustular, and not treatable medically, then only you should remove the tonsils. Because tonsils are the first line of defense mechanism in our whole body, especially the respiratory and gastrointestinal pathway. So removing tonsils or adenoids causes more damage to the children after that episode. So you should try to retain the tonsils. The best way, non-pharmacological way, is salt water gargling, then milk with turmeric and palm candy, milk with black pepper at bedtime regularly. And you also know Pund Thailam and now Pund Chain. You have this Pund Thailam or Pund Chain in the form of a capsule now called a tonsil. See, the tonsil also is helpful. Talsari Vadagam is also helpful. Adimaduram chewing them is also helpful. So you should try to contain the infection and retain the tonsils so that if there is a subsequent infection after the removal, tonsils can protect the child. At the same time, if we ignore it, any infection of the tonsils can lead to renal disease, infective renal disease, or pericarditis in children, or rheumatic fever in children. So, wherever is appropriate, you have to give an antibacterial. One of the best antibacterial that we have is turmeric, sea turmeric. Then you have the garlic oil, which are all cinnamon bark oil and clove oil. All of them are antibacterial. Mostly it's affected by streptococci and the hemolytic streptococci. It's called the manic fever. So those kind of medicines that we need to administer antibacterial. Right. When it comes to gastrointestinal symptoms, the first thing is I'm going a little change in the presentation. I'm starting with the oral ulcers. The oral abscess ulcers. You know, the oral ulcers occur to people who are all the erythematous mucosa. There's a discontinuity in mucosa that becomes an ulcer. This can happen in the lip, tongue, soft palate, and the oropharynx. This will heal by itself in a week. But very important, a person who is under constant stress, this oral ulcer is a common feature that exhibits. When people have gastrointestinal disturbance, also oral ulcer can happen. Then there will be a ill-fitting denture. If the dentures are not proper, if there is an ill-fitting dentures, that can also cause oral ulcer. So oral ulcer could be a gastrointestinal symptom, or a mind-based symptom, or a tooth-based symptom. So it's very important to de-stress the person. Very important to take adequate vitamins. When I say vitamin, I don't mean the synthetic vitamins that you have to get. Murgakira, moringa leaves, manataka leaves, solanum nigrum, the black nightshade, kamachikira in Sanskrit. Then you have the vitamin kira of the Chacramenes antagonus, vitamin kira. All this kira you have to take at least 3 days a week in food. A simple gargle with CTMR oil will help in healing the oral ulcer. A simple gargle with Triphala Kashayam will heal the oral ulcer. But these two are only symptomatic. Unless you address the stress, unless you address the nutrition deficiency, these oral ulcers will not disappear. So we have to take a caution about this. And another important thing is the constipation. You have to avoid constipation. Any inflammatory bowel disease can also cause oral ulcer. That you will be able to know because there will be an alternating diarrhea and constipation in IBD patients, or whenever they eat, they need to evacuate, and all the things that you have to take care. Oral hygiene is a must. Pomegranate juice or a wash with the pomegranate rind. No, madre water we call it. The another most efficacious substance is the flowers of Sesbania grandiflora, agathicerae. Agathicerae, you know well, is a very good vermifuge. That is the reason why it is being recommended on Dwadesi days. So there is no intestinal parasite. One of the cause for anemia or oral ulcer or nutrition deficiency in a person is the intestinal parasite. But interestingly, the flower of Zespina grandiflora, I don't know how many of you have tasted the soup of agati poo, or how many of you have tasted the poriyal of agati poo. It is very tasty to eat, non-bitter unlike the agathicerae, and it's very helpful in healing the oral ulcer. Then you have dyspraxia. See, there are two features that you have to distinguish. One is dyspraxia and other is the GERD. Dyspraxia is a chronic recurrent abdominal pain or discomfort in the abdominal abdomen. It could be because of the structure or it could be because of acid peptic disorder. What is actually acid peptic disorders? An imbalance between the gastric acid and the pepsin that is secreted. Probably you remember the pepsin and renin, the two enzymes. The pepsin and renin helps in digestion of various metabolites of our body, of our food. So, this dyspraxia, the painful sensation in the abdomen should be avoided, and the retrosternal burning, GERD, when you stoop, bend forward to get a retrosternal burning, or intracurricular, that feature. So what is to be done first is avoid excess tea, coffee. I am very careful. I'm putting excess tea, coffee because I am also I take tea and coffee. So I cannot preach somebody not to take coffee because I take coffee. But one best thing that you can do is reduce the quantum of coffee or reduce the caffeine in it, decaffeinated coffee. Tea, you can take, you might have seen a bamboo-based cup in a hand which contains lemon tea. So instead of tea with milk and sugar, you can take green tea or a black tea. So, but it should not be taken hot. This cup of tea is lying with me for the past 1.5 hours. Ever since I started, I have not even completed even half of it. I am just starting a sip every now and then. So avoid excess tea, coffee, alcohol, smoking, high-fat meals, and food at specific time, and avoid that particular food which causes the irritation. Green chili, for example. Somebody, few days back, there was somebody who came and said, "Sir, na mulaga bhaji saate." After that, I got this. So when you know the car, mulaga bhaji, the car, don't take mulaga bhaji in the future. As simple as that. Eat frequent and smaller meals throughout the day. Then, is there a need for a esophageal gastroduodenectomy or scopy? If there is over 55 years, yes, because there could be a esophageal, small cancer, small budding scope that we should identify right in the beginning. If there is an unexplained weight loss, more than 10% of weight loss, if there is anorexia, disinterest in food, early satiety, or feeling, vomiting, progressive dysphagia, bleeding, anemia, jaundice, any abdominal hard mass, lymphadenopathy, histopeptic ulcer, only then you require an endoscopy, otherwise you don't require endoscopy. How do we manage? Most patients do not require a medication. Avoid hot, spicy, pungent food. See, there is a problem nowadays. We need to sometimes mention that also, though I don't prefer to compare. Pantoprazole. Many people take it as the first thing in the morning. For months and years, I've seen treated patients withdrawn them from pantoprazole even after consumption for 6-7 years. So, Helicobacter pylori exists in everybody. Only when it exists in a higher prevalence, rate of prevalence, then there will be a problem and there will be acid separation. So in GERD, when you stoop to get it back, there is a reflux into the esophagus. There will be a retrosternal burning, there will be a heartburn. It may even mimic a cardiac condition and regurgitation of every food. Chronic cough, laryngitis, recurring pulmonary infection. Because why recurring pulmonary infection? If this food content comes through the food pipe, sometime or occasionally it can enter through the windpipe and cause infection in the lungs. Okay, diagnosis by history. First is the non-pharmacological treatment, reduce obesity, exercise, elimination of fatty food, avoiding alcohol, smoking, avoiding excess consumption of tea and coffee, food at the right time. When I say food at the right time, not is 12 o'clock, 1 o'clock, 2 o'clock. It is about positive pussy. The moment you get the first sign of hunger, take a food. Don't skip meal for whatever reason. Right? Keep your head elevated in the bed. Take early dinner. See, there's a culture nowadays. Most people take food at 9, 9:30. They dinner, go out, partying. Fortunately, 2 years there will be no partying. Otherwise, you keep going for any wedding, reception, this, that, and all. Take a late dinner. Right? Patients with postprandial symptoms are suggested to take small meal but frequent meal. There are only 2 medicines that I prescribe. Though I know of Kurnokurari and know of other things, I prescribe only 2 things. One is Yeladichuranam. When I say Yeladichuranam, you please confirm the formulation of Vaidya Yoga Radhamani, the Ayurvedic formulation, the Siddha formulation. Compare the Yeladichuranam with Imcos and Iskay. Maybe Aushadhi also, because Aushadhi has also started manufacturing Siddha medicine. The quantum of ALRD is very critical. Sometimes they add more of black pepper, cumin, and other things. The ALRD level is reduced because of the cost cutting. Therefore, it is not very helpful. That is why Imcos. Why I quote Imcos is mainly because I am able to influence their formulation much better than other organizations. SKM also takes my advice seriously whenever I tell them. What happens is they have distinguished Eladi Churna Matrai into Ayurveda and Siddha. They try doing different color labels and nothing worked. Now they have made it as Eladi Mathirai for Siddha. So Eladi Mathirai Siddha contains more of cardamom, and therefore, what is the taste of cardamom? From the spice country, Kerala, what is the taste of cardamom? ஏலம் எந்த ஃபுட்ல ஆட் பண்ணுவாங்க? பாயாசம், லட்டு, சக்கரை பொங்கல், all sweet dishes. Right? Yeladi is a sweet spice condiment. It's not a pungent spice. So, you know, anything which is sweet is kapham and which is produced the pittam. Any gastritis-like symptoms are pittam. Therefore, yelam, which is of kapham nature, with a sweet nature, will bring down the pittam. So, Yeladi Siddha, Yeladi Matra Siddha is more effective. Then the Muttichippi perfume. Muttichippi perfume you don't regularly get it in most markets, but Muttichippi a Shuddhi Pashma in Sanskrit, or Suktin, a tablet in by an LSN company. Though I don't promote brand in a standard treatment protocol, but for a clinician, it should be available accessible. So these two, Yeladi Churnam and Muthuchupi Pashpam, for 3 days in 15 days, most of the persons get well fast. Diarrhea, frequent just to more than 3 times a day. It can depend upon the region. It could be watery, it could be mucus, it could be blood. Then you call it as dysentery. We know to distinguish between diarrhea and dysentery. And children, it can occur in other diseases like malaria, pneumonia, ear infection, other conditions. And one of the critical symptoms in corona also was diarrhea this time, particularly in the second wave. It can lead to malnutrition. Malnutrition can cause diarrhea, and diarrhea can also cause malnutrition. It can also cause hypoglycemia and diabetic. And very important, home-based ORS, salt sugar solution. RC kanji with Omam, Oma kanji. How many of you regularly use Oma water? How many of you use whey water? What is whey water? Boil cow's milk, maybe 100 ml. When it's hot, add some nimbu, lemon, desi padam, juice, elumicham juice. The solid will become separate, which is what we call the cottage cheese, and the liquid will become separate. That is what we call the whey water. Whey water, when you consume, increases the normal bacteriflora, the healthy bacteriflora of the intestine, which the diarrhea, which is the diarrhea could be a viral disease, which in viral diarrhea it will be greenish color. So in viral diarrhea or bacterial diarrhea or a food poisoning diarrhea or this thing, the normal bacteriflora of the intestinal pathway will also get destroyed. So simple whey water will regenerate what is equivalent to what we call the probiotics in Western medicine, which you can make at home. Oma water you can make at home. One of the best for amoebiasis, dysentery and diarrhea is the Chlorina antidysenterica, Kurasapalapatite. Very effective, either drug. Sweda Indrajwa, sweet kuracha is what? Hytia tinctoria, which you use, the seeds that you use in, or the leaves you use in psoriasis. Pomegranate rind, Madalai wood. Madalam pinjo also is very good in arresting diarrhea. Madalai wood, it's available, but you can get it. Madalai podi. Ashachuranam, if diarrhea is because of indigestion. Okay. Then constipation, I won't explain, but one thing I want to tell you is, if the very elderly person complains of constipation, you may have to do a sigmoidoscopy and this thing, proctoscopy, because it could be because of cancer. Otherwise, constipation is a sign when there is dehydration, when there is less water intake, when there is less of fiber intake, constant sitting, no physical activity, no abdominal movement. See, abdominal peristalsis requires some abdominal movement. Deep breathing exercise helps. Forward bending, backward bending helps. We forgot to do all these things nowadays. That is why constipation. In diabetic patients, more water is lost in urine. Therefore, less of water in the gastrointestinal pathway, particularly rectum. So constipation. So the best way is reassurance from pregnant women with high fiber diet. Partha Mundan Kira Sapadman is a must. Retaining the bowel, that is abdominal exercises, regular physical exercise, even including walking, taking plenty of water, and bulk forming activity with the CTMR. We also have a fenugreek metica seeds, Acacia Savaconda puri with liquorice cardamom, and Acacia angustifolia, Nilavage. Nilavage only you have to use only the old one. The recent one will cause the tripping abdominal pain. Nilavage, when you take, you have to always use liquorice and cardamom. That is why Nilavage formulation on the Adimadramu, ஏலமும் இருக்கும். Right? So these things, one of the best things that I have come across in elderly people is, okay, the Ayurvedic colleagues may give Matra Basti, but for me, the well-known Karka Pinjil and Amanaka, 10 to 15 grams of Karka Pinjil roasted in Amanaka oil, castor oil, and powder and blend with rest of the 85 ml of castor oil and 1 or 2 teaspoons in the morning, once a week or twice a week, depending upon the constipation. In 6 weeks, rectum and the intestinal pathway comes to normalcy. Then deep breathing exercise, abdominal exercise in younger persons or even elderly who can sit and do it at home should not be a problem, and follow with Methika, fenugreek regularly, and Kira twice a week. So it's not necessarily that you have to use another, otherwise the patient is impacted food. You have to give Veera NA or Pora NA. Intestinal protozoal, maybe it's a long way to go, but considering the time, I need to give you some 10 minutes time for question and answer session. Otherwise, it will be unfair for me to have a monologue. So I close my session here. Maybe God willing, we will meet again. Thank you very much.
If anyone has got any doubt, you can please ask now. Sir, I think that no one is having doubt now because the topics are clear as so far covered.
One minute. Go to the previous slide. See, one of the important things in a pediatric practice, maybe we call it in a pediatric practice also, that the intestinal parasite is one of the major problems for anemia, malnutrition, and less of IQ in children, and the chronic itching or the anal orifice. So the best practice that I've seen is a good hand wash practice that Kerala has been promoting in a very big way, hand wash, and not even before the COVID. Agatti Kirai, once in 15 days as vegetable. Similarly, every week coconut milk. You have a coconut country, Kerala, so you should give your children, maybe you are giving already, if you give coconut milk once a week to infants and children, they don't get industrial manifestations at all. Parasites will not come there. That is one of the best things to do. And vermifuge is the Karka Pinjil, which is also very helpful, right? So we try to prevent intestinal parasites growing inside the intestine and remove them. We're not try to kill them. Okay, there are two other things. Erythema indica is pulmurungai that you may not get everywhere. Indigo tinctoria, we have less using that. We are using it in psoriasis. We are using it in dandruff. We are not using it much in liver diseases. Though it is very useful in liver disease, it's also one of the best known vermifuge, auric kachayam. That is why in skin diseases, auric kattai with the milagu is mentioned. Okay, and start. Thank you, friends, for your patient attendance. I know it's a 2-hour session on a Sunday afternoon after a heavy lunch or a holiday is very difficult. But I requested Anupama to have it on a Sunday afternoon between 2 and 4, mainly because on working days we have clinics in the morning or evening, both you and me. So we can't afford this kind of 2 hours time for this. We should spend time in this kind of exchange of ideas, views. But today it seems it is more of a one-sided thing. I don't know why, but whenever we meet again, it should be a dialogue. It should never be a monologue. One person cannot be talking all the time. We should be
Sure, sir.
interacting more. Thank you very much.
Sure, sir. Thank you very much, sir. Thank you for your valuable session, sir. Um, thank you all for the participants also for participating in this webinar. Although you may not have shared your views or your doubts here, maybe you will be sharing it in the group. Anyway, thank you. And our next session is on Wednesday. I'll be informing it in the group about the session and all. We'll be having a session on diabetes by Dr. Gayatri from NIS. And thank you once again, Dr. Thirunarayanan sir, for spending your valuable time with us. And thank you all.